Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss types of injections. Who all have visited first time on this channel, please do subscribe and watch. Your types of injections. First one is intravenous, intramuscular, subcutaneous, intradermal, intracardiac and then intraarterial. We'll discuss it one by one. First one is intravenous here. Here, intravenous directly enter into veins and then needle enter in vein at 25-degree angle. You can see in the picture 25-degree angle, and then medicine rapidly action by this route, by IV, by the route of IV, and the injection can be given by infusion or direct. Next one is intramuscular. Here intramuscular directly enter into deep muscle, and then needle should be put at 90-degree angle. Here in the picture you can see 90-degree angle, and then water and aqueous solution rapidly absorbed, and then oily solution slow absorbs here. It's all about the IM. Next we'll see subcutaneous. This type of injection inject in fatty layer. Injection angle should be 45 degree. You can see in this picture 45 degree, and then medicine very rapidly absorbs here. For example insulin. Okay, next cutaneous, that is injection inject in superficial dermis layer of skin, and then injection angle should be 10 degree to 15 degree. In the picture you can see there. And then for example, here it is for the diagnosis to check medicine sensitivity. Okay, next intracardiac here. Inject in heart muscles or ventricles. It is only used in emergency conditions, not everywhere, only in emergency conditions. For example, epinephrine injection. I hope you all are clear with the routes of injection. Please like, share and subscribe to my YouTube channel for more information.